Are X-rays and CT scans worth the radiation? Most doctors say it is, but others do disagree. So today in this presentation, I'm going to show you why the radiation accumulated from the X-rays and CT scans are definitely worth the images. So what is radiation? The CDC in 2022 defines radiation as energy that comes from a source and travels through space at the speed of light. Well, that's not very applicable or understandable for the patients getting these scans. So there's a term, cosmic radiation, also known as background radiation, that is used to determine the amount of radiation that is presented. But cosmic radiation is defined as a high energy charged particles, such as X-rays and gamma rays that are produced in space. So could radiation severely hurt my body? These signs are posted on X-ray and CT scan doors to warn patients about the radiation they might accumulate. So the levels of radiation. Smaller doses are around 1.001 millisieverts and 5 millisieverts, while the medial doses around 6 to 14 millisieverts, while larger doses accumulate to around 15 to 25 millisieverts. These larger doses are going to include your dental scans. Their medial doses are for a chest X-ray, and then larger doses are going to be your radiation and full body X-ray scans. So what kind of images are made? The two most common scans that use radiation are CT scans, also known as computed tomography scans. They use radiation to get a full body image of the patient, including bones, and can get other smaller systems as well as the bigger systems. X-rays are used for a smaller, more detailed image, usually a photo of bones to check for a fracture. This is very common in legs, arms, and wrists. Effects of smaller doses. These smaller doses are comparable to a 1 day to a year and a half of background radiation. That might sound a lot, but usually a year of background radiation has no effect on the body, so no complications may occur. The most common side effect is usually a headache, sometimes a little cough, but normally just a headache. Some effects of the medial doses, comparable to 2 to 5 years of background radiation. Usually 2 to 5 years of background radiation is quite a lot of radiation for someone to occur in such a short amount of time. So some complications may occur, such as a strong headache, nausea, vomiting, and a later appearance of cancer, depending on how old the patient is. Effects of larger doses, comparable to a 5 to 8 years of background radiation. With the extreme amount of radiation that is present in these scans, these are usually used on patients that will die if they don't get the radiation or the treatment that they need and use the radiation to get the scans. So many complications such as the earlier cancer growths, organ failures, and irritations of the skin, as well as all of the medial dose complications. So is the radiation worth it? Absolutely. There's a purpose for the scan. The doctors won't just give you one if they don't think anything is wrong with you. There's no incision necessary, so there will be no remnant of these smaller radiation doses or X-ray scans. So they're very detailed and get a wide variety of systems in the body in just a single scan. And again, the most common types of X-ray scans are the smaller doses, such as a hand X-ray or a leg X-ray, so no complications will occur. Are there any other alternatives to radiation? MRIs are very common and use magnets to make an image of the body, so no radiation is used. But they're really only used to see the inside of organs and the bones. So why is radiation the best treatment? They're fast and accurate scans. They give an in-depth look into the organs. In many CT and X-ray scans, they can see any complications around that area. So only in rare cases as cancer growth or signs of a cancer growth because of radiation that actually lead to a fatality. So Most common scans really don't affect the body, so there's no need to worry about the radiation that you're getting. Here are my references, and thank you so much.